Good afternoon, all. We invite you today for an insightful talk on hip pain. And to shed light on this topic, we have Dr. Anup Dhamangaonkar, joint replacement surgeon and orthopedic consultant at SLRH.
Thank you, Dr. Melna, for the kind introduction. So we are going to talk about a very important topic, and it's surrounded by a lot of questions in our audiences about hip pain and what are the causes, what are the steps to prevent it, and what is the treatment modality for the same. So thank you for having me on the show.
Thank you so much, sir. And getting to some of the common questions I'm sure our audience must be having. So what are the various causes of hip pain?
Right. So amongst the causes of hip pain, let's understand what is the structure of the hip joint. So जो सांधा होता है उसकी रचना क्या होती है? So it's basically a ball and socket joint. So you have the socket in the pelvis bone, and then you have the hip, which is a spherical structure which is rotating within the socket. So when we talk of causes, we divide them into two major groups. One is causes which are starting from the hip joint structures themselves, and because of origination or originating from the structures surrounding the hip joint. So when we talk of true hip pain, it starts from the hip joint. So you have arthritic pain which starts from the hip joint. Then you have got labral injuries. Labrum is a structure which deepens the socket. So it's like एक rim रहती है tissue की जो कि सांधे को और deepen करती है. So if you have any kind of labral injuries, that also leads to severe hip pain. Then there are causes which are fractures. If you have fractures around the hip joint, it leads to severe hip pain and immobility. Then there is osteonecrosis or bone death that we'll discuss as the show goes on. Then there are infections, which are again a major source of hip pain. If there is any swelling or infection in the hip joint, that can present as pain. And there is an entity called femoroacetabular impingement, in which there is either the socket is too deep and it captures the head, which can lead to hip pain, or else the head itself is a little deformed. Both of these can cause pincer or cam type of two types of impingements, which are true sources of hip pain. When we talk of source of hip pain because of structures around the hip joint, mainly it's talking about bursitis. What is a bursa? When we have airbags in our cars, so whenever there is any injury or any trauma, it deflates or rather inflates, and then you have got that inflated bursa. Similarly, you have got these airbags around the joints in the body. So whenever there is any friction or trauma, they are inflamed, they are swollen, and that is a protective mechanism of the body. So amongst these bursitis, there are two major causes of bursitis. One is a trochanteric bursitis. So that is the reason for outer part of your hip pain. So बाहर की तरफ जो pain होता है hip के, वो trochanteric bursitis की वजह से हो सकता है, and that's essentially because of elderly patients lying on one side, or if patients have a broad pelvis because of constantly aberrating the structures of the bursa, it leads to swelling. The other source of bursitis is the iliopsoas bursitis, and this is common amongst athletes, in runners, because of sudden flexion activity. If they are doing a lot of squats, heavy deadlifts or something, that can lead to friction of the bursa below the tendon, and that can present as bursitis. Other common sources of pain are iliotibial band syndrome. So when you have runners which are running for long distances, marathoners, आपको महसूस भी होगा, आपको खुद अगर दौड़े होंगे, you will get pain. मांडी के बाहरी तरफ आपको काफी हद तक दर्द होगा when you're running, and you would have to stop. And that is a part of iliotibial band syndrome, and that's common amongst the runners. That's again because of inflammation of the tissues around it. Again, an important source of hip generation is not the hip per se, but if you have any kind of spinal stenosis, or if you have any elderly patients, you have got nerve root canal stenosis or lumbar canal stenosis, or a herniated disc which pinches on the nerve root, you'll get radiating pain in the back of the hip. So it's very important to understand what is the source of this hip pain. So it is either from the hip or because of structures around the hip. So that's what I would put it as. So diagnosis is absolutely important because that will take us to what treatment modality we can choose.
Right. Thank you so much, sir. That was very informative and very easy, I think, for our audience to understand as well. तो आप सर कौन से ग्रुप्स में जनरली कॉमन होता है हिप पेन होना?
Right. So hip pain, अगर हम बात करते हैं तो right from childhood till your geriatric population, मतलब जो बुजुर्ग लोग हैं उनमें भी ये commonly दिखता है. So children में child till about 14, 16, 18 years of age, you will see common causes of pain being infections, which are again very common, tuberculosis or otherwise. You'll have young patients, if they jump suddenly off the bed, school-going kids, you'll have some kind of effusion or swelling, जो सांधे में जोड़ में सूजन आती है. That can be the source of hip pain. Then there is Perthes disease, which is common in younger age groups. Then we come to young active adults who are seated for a long time. They can have these impingements, which are very common, or labral injuries, which are very common. In young athletes who are running for a long distance, if they are suddenly pushing their weights, that can lead to these bursitic pains or iliotibial band syndromes, or even chondral lesions because of extreme excessive movement like rowing, etc. So those are amongst the young active patients. When we talk of elderly population, that essentially is the traumatic group. So the fractures around the hip are very common, and that's because their bone density, जो हड्डी काफी कमजोर रहती है, तो अगर बुजुर्ग लोग जोर से बैठ भी जाते हैं कुर्सी पे तो भी फ्रैक्चर हो सकता है. So that is the age group that we are looking at for the traumatic causes of hip pain. So it's pretty much along the entire spectrum of age groups that we see hip pain, but the sources of hip pain are quite different in most of these patients.
Yes, sir. That was also very informative and clear. So, and like you mentioned a few minutes before, you said something about bone death or AVN.
Yeah. So there's a lot of hearsay of osteonecrosis or AVN these days, and especially in the post-COVID scenario. Why are we seeing a lot of these AVN cases? You see a lot of articles coming up, and what AVN means is जो खून का दौरान रहता है supplied to the femoral head, that is blocked, and therefore the femoral head suffers from osteonecrosis or death of that surface bone. Now, why does this happen is because of excessive use of steroids, which was needed at that time during the COVID situation. The blood supply is basically restricted, and therefore that leads to osteonecrosis. So excessive use of steroids, excessive use of alcohol, कुछ प्रमाण से is hereditary as well. So it can because of sickle cell disease or hematological disorders. बहुत सारे cases में कुछ कारण भी नहीं होता, but it leads to osteonecrosis or AVN hip. Now, when we talk of AVN hip, it's not that we need to jump in for surgery. Okay, so that's very, very clear. So it undergoes 4 stages. 4 stages में AVN progress होता है. So in the earlier stages of AVN, we can watch for the progression. There are bisphosphonates or medicines which retard or slow the progression of osteonecrosis. So we need to have the patient on some medicines. We give them some medicines to retard the pain, which is bisphosphonates. We ask them not to have impact activities. So all this is what we do to watch the patients for their progression. Now, patients who are in the intermediate stages, so they have got hip pain, but they are able to do most of their activities very well. But it's only the hip pain, especially the night pain also, that is troubling them. So in those cases, we do an MRI. We find that there is a lot of swelling in the bone. And what we do for those patients is not a replacement directly, but we do something called a cold decompression या drilling. तो फीमर की हड्डी में हम ड्रिल करते हैं. ड्रिल करने का मकसद ये होता है कि हम जो खून की जो ब्लड वेसल्स रहती है उसके इर्द गिर्द का प्रेशर कम कर देते हैं. So when we drill, we basically depressurize the blood vessels, which then throw up with new blood vessels. At the same time, we augment this forage or decompression procedure with stem cells also, जिससे हम सोचते हैं कि और खून का दौरान बढ़े और ये progression रुक जाए. Then we come to the later parts of the disease progression, stage 3 or 4 fecal in which patients को तो दर्द होता ही है, but along with that they have got significant disability in doing activities of daily living. So even sitting on a bike is a problem. Sitting in a chair becomes a problem. So they have got a severe limb, and they are, mind you, in a very active, productive part of their life. So from 35 to 65 is your productive years of life, and they cannot afford to lose that productive years of life. So even in those cases who are young but having severe disability, we do a total hip joint replacement. Now, what is the difference in the joint replacement implants that we had maybe 20 years back and now? We need to understand that total hip joint replacement is a very successful operation. It has been labeled as the surgery of the century as far as the success goes. And now the joints that we use are quite good quality. We use good tribology, so whatever bearing surfaces we use are going to last possibly a lifetime for the patient. So ceramic on poly bearings or ceramic bearings, they are the ones which last for a very long time. Secondly, we have come out with something called a dual mobility articulation, in which the patients are able to do all their activities, including sitting cross-legged, their prayer position, everything is possible. as far as their activities of daily living goes. So the disability goes down significantly from the very next day of surgery. So I think for maintaining that quality of life, we need to offer a total hip joint replacement even in young patients. Okay, and it may not lead to any disability per se as far as their activities of daily living goes. So that is how I would put my treatment plan right from early stages of osteonecrosis to advanced stages of osteonecrosis.
I'm sure that cleared a lot of misconceptions that many people were having. So, and in the elderly, like you mentioned some time ago, if you could shed a bit more light on, what are the common causes of hip pain in the elderly patients?
That's right. So again, we'll divide them into traumatic fractures. So traumatic, why is because they have got severe osteoporosis. Most of these elderly patients are not mobile. Because they are not mobile, their bone quality is very, very poor. So even a small little jerk, like twisting your foot in the bathroom while wearing your chappals, sitting on a hard chair quite rapidly, if they have any kind of local bruising as well, that is significant fall or for them to have a fracture. Okay, so and most of these patients, they are kind of these fractures are neglected because the trauma is not quite severe. You don't have a bike accident to cause these injuries, right? So most of these injuries are kind of neglected. They are at home, they are icing, they are resting, but still they are not able to lift their leg. The leg falls out. So that is the kind of traumatic injuries that we see in elderly population. Secondly, most of these patients are on some medicines for their osteoporosis, and one subset of these medicines, which is bisphosphonates, if we take them for a long time, they can present as atypical stress fractures. So those are also reasons for thigh pain or hip pain that we have. Then we come to even young patients, as in elderly, can have severe osteoporosis, and stress fractures are common. So stress fracture is basically because of severe osteoporosis or the severe lack of vitamin D, that without any trauma they have got some kind of intramedullary. So हड्डी के इर्द गिर्द ही फ्रैक्चर अंदर होता है. फ्रैक्चर मतलब क्या, हड्डी की जो अंदरूनी रचना है उसे क्रैक जाता है, जिसके कारण हड्डी में ही सूजन आती है. So that those are called stress fractures which can displace later on. So in elderly population, this is what we are looking at as far as hip pain goes. Of course, when we talk of elderly patients, it's not only hip, they have also got degeneration at the spine. So they have got some spinal stenosis. So नस भी दब चुकी होती है, जिसके कारण अगर पूछेंगे उनको कि चलते समय दोनों पैर मांडी के पीछे से आपको पूरे दर्द होता है, आपको चलते समय बैठना पड़ता है. So that can also be one of the source of hip pain when we are talking of elderly patients. So again, diagnosis is absolutely important. At the same time, message is that you should not be ignoring hip pain, especially the groin pain or lateral thigh pain in elderly patients, and seek help.
And in relation to elderly patients, काफी लोगों को लगता है कि हिप फ्रैक्चर्स ट्रीट करने के बाद या उसके वक्त बहुत महीनों तक उनको बेड में रहना पड़ेगा.
Right. I think it's a very valid question. So even if you have your own relative, we'll think twice whether we should have a surgery done on an 80-year-old. Okay, so I think this is a very valid question. But you need to understand that if these fractures happen in an elderly and the patients relatives are not willing for surgery, nursing care is a real problem. Trust me. So if they cannot get up, if they cannot take weight, even simple things like making them sit up from the lying down position to a chair, or changing their diapers, changing from one side to the other, all these movements cause hip pain because you're having some mobility at the fracture site. Okay, so all these movements of daily living or basic nursing too are very difficult for these elderly patients with fractures. So from the nursing point of view also, and to get them out of the bed, surgeries are essential. So what are the surgeries that we offer for elderly patients with hip fractures? Unlike earlier cases where we had to open up, we had to take the patient, be in bed for a long time, we have evolved a lot as far as implants goes, about our medical management goes. So safety first, they are all fit for anesthesia. We have a thorough evaluation and only then take them up for surgery. So it's, as far as their safety is concerned, that is paramount. Secondly, when we talk of fractures which are intertrochanteric, जो सांधे की थैली रहती है, जोड़ की थैली रहती है, उसके बाहर के हिस्से में जो फ्रैक्चर्स है, उसे इंटरट्रोकैंट्रिक फ्रैक्चर्स कहते हैं. जो थैली के अंदर के फ्रैक्चर्स रहते हैं, उसे इंट्राकैप्सुलर नेक फीमर फ्रैक्चर्स बोलते हैं. सो इन एक्स्ट्रा कैप्सुलर, जो सांधे के थैली के बाहर के जो फ्रैक्चर्स है, वी फिक्स देम अप. उन्हें रिप्लेस नहीं करते, हम उन्हें जोड़ते हैं हड्डी के अंदर एक रॉड डाल के, जिसे PFN कहते हैं, And these implants have really evolved and changed our practice, because we can make the patient sit up, change sides, make them stand the very next day of surgery without pain. So it fixes the fracture so well that we can mobilize the patient. Secondly, intracapsular fractures, we do a hip replacement surgery, so by which the patient's pain is completely treated the very next day. They are able to walk with the walker. So these are two different situations, but we can have a good operative result after the surgery as regards to getting the patient off the bed and get them walking. So exactly the reverse of what people think. After the surgery, we are actually getting the patient mobilized rather than they being in bed or being bedridden.
Okay, so I'm sure that would have cleared a lot of worries and doubts that people have been having. So, and lastly, what would be your advice today, sir, to people in the audience and in general to people who are having hip pain?
Right. So I think this is an important take-home message. There are many causes of hip pain. As you realize, we've discussed those causes. It's very important to find out what is the source of your hip pain. Why is because if we find the source of hip pain, we can possibly treat it or retard it, or we can have some kind of lifestyle modification to prevent progression of your hip pain. So as if you have some hip pain, the first important thing that you need to do is keep your hip joint off weight bearing. So don't indulge into high impact activities or running. Don't walk on a cement floor. Have your soft shoes at home as well. Of course, wear sports shoes outside. Apply a lot of ice. So that rest, ice treatment that we follow, that is absolutely important. So rest, ice application. Compression is what we can't do, and elevation. So you just rest your hip to some extent, so that will treat your hip pain or relieve your hip pain for a while. But if you do have persistent hip pain, definitely seek help of an orthopedic surgeon, because it could be as small as having a tendinitic pain or a sprain in your hip, or it could be as severe as getting a hip arthritis or severe spinal canal stenosis or hip fracture as well. So it's important that you seek the help, take help of a orthopedic surgeon, and don't ignore your hip symptoms. Okay, that would be my take-home message.
Yes, sir. I think that was very informative, and I think it'll help a lot of people understand hip pain better and know what to do when they have these symptoms. So thank you so much, sir.
Thank you.
And thank you all of you all for joining us on this talk. And if you have any of these symptoms or complaints that we talked about today, please do come and visit SLRH hospital. And as you saw today, you will be well taken care of. So thank you so much. And
Thank you.
so
Thank
much.
you for having me.